everybody, and welcome again to the Musical Innertube. I am Don Rooney.
And I am John Timpane, and today we are proud to welcome back to the Musical Innertube Art Caplan, who is currently the Drs. William F. and Virginia Connolly Mitty Professor and founding head of the Division of Medical Ethics at the NYU School of Medicine in New York City.
Hey, thank you for having me.
And let's pick up the conversation where we left it last time. Last time we ended by looking ahead to where we are right now, which is the release of the vaccines. And I guess there's a second one now just about to come on the market. And I'd love to hear what you're looking at right now as you survey the headlines and the news, because it's an exciting, dramatic time.
Well, it is exciting, and I have to give some props to the scientists at Pfizer and Moderna. They developed a vaccine in record time.
Yes.
They basically used a new platform, a kind of genetic trick where they get the vaccine in you and it tricks the body into making little spike proteins, those bumpy things we see when we see pictures of the virus.
Yes.
And then when the virus shows up with those bumpy things, the body attacks them. So it was a very clever approach, and that's amazing. That's all the good news for the podcast. Now let's talk about all the troubling.
What do you worry about, I guess, is the question.
See, you get in the ethics rule, and they only want to know what you worry about. You can't get away with praise. Okay, so a couple of things. One, both of these vaccines are pains in the neck to handle, particularly the Pfizer one. It's got to be kept very, very cold. They're both 2 shots. And the Pfizer one comes in packages of 1,000. So what's bad about that? Well, you need special refrigerators and trucking, hard to ship. I don't think the Pfizer one's getting out to very rural areas. It won't be at CVS. They don't have the refrigerators for that. So it's going to be hospital-based availability.
Yes.
The Moderna one, a little easier, but also 2 shots. It needs some refrigeration. But 2 shots is always troubling because people don't come back for the second shot. And there's a couple reasons. One, they maybe get a sore arm from the first one and they think, I don't want to do that anymore. Sometimes they forget. Sometimes they just believe that they got the shot and they really didn't get the idea that they should come back. So those are downsides of those vaccines. We have a vaccine for cervical cancer, HPV, human papillomavirus.
Right.
It works very well, but it's 3 shots. And I can tell you that easily 30 to 40% of particularly young women who get that to prevent cervical cancer don't come back for the 3rd shot.
Now, I remember back in the days when that was first being discussed, and I had a chance to have some conversations with you about that because it was controversial politically when it first came out. And the sense was that having multiple shots was going to degrade the numbers that would get full coverage.
Absolutely. And it did.
So do we have experience showing that the women in that cohort, that those who only got 1 shot, they aren't protected? Do we know what the consequences of that have been for not getting all the shots?
It turns out, and this is true, by the way, for Moderna and Pfizer COVID vaccines, you get a little protection, but not as much. So you lose 20, 30, 40% of the protective effect. So it's not useless, but it would be better to get the full run.
And when they give me my first shot, do I get tracked until I get the second one? Is there a system in place that tracks where I move to, or do I get a card when I get the first shot? What happens with that?
So they do register you for these COVID vaccines, and they will try to call you or email you. But remember, if it's hospital-based, they're pretty busy. If it's hospital-based, it's likely to be where the COVID patients are, and the staff is probably very busy with that, along with the usual business of hospitals. So I don't think they're going to be able to do a great job nagging you. They will follow up, but if you get the 1 call and the 1 email saying time for shot 2, that's probably going to be it.
So that's amazing. I guess, obviously, that would entail just a whole other, one more logistical challenge, wouldn't it?
Yes,
exactly.
And
they just decided, man, we are just doing enough already with the refrigerated trucks already that, right, that we're
And
not
remember
going.
this too. If you open up a package of 1,000 Pfizer shots, they only last 6 hours, so you got to have 1,000 people standing in a line or someplace to give them out, or you're going to waste a
Right.
fair amount of it. So that's another logistics problem.
We got to move these refrigerators. Yeah.
Yeah.
We just-
Yes. Yeah.
Right.
That's a dated reference, but I got it.
Yes. I think, and I know Don wants to get into the conversation, but I want to just follow up on this, that it really, what it seems to boil down to is that we have an honor system for those who are getting the shots. I mean, what boils down to one.
Yeah, I think that's right. That's you're kind of going on some personal responsibility, and also paying attention when you get the first one to what they're saying, not just sort of zipping through. Now, here's one other bit of good news. The vast majority initially of the people who get the Pfizer vaccine are healthcare workers and nursing home residents. The healthcare workers, I think, will be a higher chance of coming back for shot 2. And the nursing home residents aren't going anywhere, so they're pretty likely to get shot 2. Where we get into problems is when we get past those initial groups to the ordinary citizens who are wandering around all over the place.
I see.
2 other vaccines right behind these 2. One is made by AstraZeneca. It's a single shot and requires some refrigeration. It's not that far along in its clinical trials. Janssen has one that is kind of the one you get at CVS, and they can make a lot of it, and they finished enrolling. They're going to try and give us early data end of January. If that one pops in, that's enough to vaccinate a large number of Americans. So even though we're all excited about these 2, the Pfizer and the Moderna, keep your eye out for that Janssen vaccine the next couple of weeks. If that gets approved, I think you're going to see 100 million Americans get vaccinated.
That's amazing.
That's terrific. Well, here's where I wanted to get in on, Art. You wrote an article for the New York Times not too long ago in which you said that we need to be New Zealand, basically. What did you mean by that?
Well, vaccines are great, and they're very exciting. If you looked around the country, we're in a mess. We have ICUs overwhelmed in Los Angeles. We got the virus spiking everywhere. Compared to the rest of the world, we are like horrible. We have more cases and deaths, and we're not doing anything about it. San Diego is arguing about whether they should close strip clubs. Are you kidding me? And, other places are like, well, we'll keep the restaurants open at 50%. The lesson of New Zealand is if you want to control this virus, you got to go to a much tighter lockdown, close the schools, close the businesses, close the strip clubs, I guess, close down visits, and certainly don't do things like have rallies and Christmas parties, particularly with people without masks. New Zealand used that, and I know it's small and I know it's an island, but nonetheless, they got very much better control over this thing than we have.
They had an amazing degree of buy-in from the public, didn't they? I mean, compared to what we get here.
Yes. So they were more community-minded. I think people didn't fight with the government as hard as people do here. But still, I blame Trump because he did not set a good example, and his message was, you don't have to do this stuff. Then people began to say, well, he says you don't have to do it. I'm not going to do it. Meanwhile, he gets sick. Giuliani gets sick. Carson gets sick. Christie gets sick. His press secretary gets sick. The whole White House is sick. And you should be taking a lesson there that maybe his strategy wasn't that great.
Yeah, I think so. Here in Pennsylvania, where I am, the governor has reverted to shutting down bars and restaurants and gyms and everything through the first of the year, trying to keep things down. And I think probably also trying to short circuit the gatherings for the holidays. And of course, all we're hearing about now is the restaurant owners that want to defy him and stay open because they're saying that they're going to go out of business or their employees are going to go broke.
Yeah.
How do you handle that?
Yeah, New Zealand did something else. They subsidized. So if you want people to comply, throw some money at them. I don't know how much or, enough at least to the restaurants to survive. I don't want the restaurants to go out of business. I'd like to come back to a post-COVID world where we could go out to eat and go to a gym and go to a strip club. I don't know. I'm obsessed with the strip club thing here, but do our usual activities. And that requires some smart economic thinking in addition to smart epidemiological thinking. So it's not cheap, but the cost of losing all those businesses in terms of jobs and so on, it's got to be cheaper to subsidize them than it does to see them close.
Right.
What do you think the incoming administration, the Biden administration, has to do to get us on track?
Couple of things. One, I think they have to bring science back to the table in a serious way and say we're going to listen to them more. We're not going to make fun of them. We're not going to put them down. I think they should be good role models. Biden's going to get the vaccine, and he's an older age, high risk person. So I'm not going to fight it, but be a role model. I think that will help. He masks everywhere. He's asked us to wear masks for 100 days. I think that's great. Trump asked us not to wear masks anywhere at all. Bad. And then I think we got to, attend to the economic policy and subsidies. I do think throwing money out to keep small business going, the unemployed going, that is part of a plague. I don't like saddling future generations with the debt, but I think you gotta do it. I think they will try to reconsider the school policy. There is some argument that can keep the schools going if you protect the teachers, if you do a lot of testing. So I hope he starts to really emphasize more testing, cheaper testing, easier to get testing. I take less accurate testing, but I get more of it. If I falsely quarantine somebody because they test and they really didn't have it, okay, I'll live with it.
So we probably can put up with a certain degree of false negatives and false positives.
That's what I think. I do. And I think also, if you could get home testing, people say, well, you don't want that because it may not be as accurate and people will lie. And who cares? At this point in time, the thing is out of control. So, I'll take a little lying about that. Just get the testing.
What's a little lie?
Yeah. Right. Small amount of lying.
Vice President Pence got the needle, and so did his wife, and so did our Surgeon General. And I think in all three cases. By the way,
I don't think we saw during the entire plague, but okay. Yeah.
Well, I think that he was told not to appear so often. I mean, I'm just assuming this, just looking at what happened. The people appear when told and don't appear when they're told to stay off TV. But he wanted African Americans specifically to realize that this is for them, that they should not hesitate. And I just thought I was very struck by I think that was a very aware thing to do for the Surgeon General, especially.
I like that. I'm glad he did that. I was a little less thrilled that Pence and his wife were there because I don't know that they're really in a high risk group. And to be quite frank, I'm not sure they're going to role model behavior that people will pay attention to. It might have been better if Pence went to a nursing home and watched when somebody got vaccinated or an ICU or something like that.
Interesting.
I'm not against him getting vaccinated, but I would have waited a couple more weeks. The need to get the poverty-stricken minority communities that are getting hard hit to trust, and the polls show they don't, more than most. Okay, I get that. But, this is America. Celebrities count. So as much as politicians might be of interest, it probably is going to take athletes and movie stars and social influencers to really make a difference. So I hope over the next month or two that happens.
We hear in the media a lot, and that's just because of what the media is, about these people who are complaining and not wearing masks and that sort of thing. But I'll be honest, I go to the grocery store, everybody's wearing a mask. I go to the drugstore, everybody's wearing a mask. So do we have a sort of a situation here where the squeaky wheel is getting all the attention, but in reality, most people are falling into the good habits that we've been encouraging them to do?
No. We have a split.
Well, darn, there goes my optimism right out the window.
Happy New Year, though, Don.
Thank you.
I'll bet where you are, Don, where John is just outside Philly, and where I am in Ridgefield, Connecticut, there's no one without a mask. There's no one who doesn't try to social distance. I'm pretty sure everybody in the town of Ridgefield, a pretty, moderate liberal blue place is trying to stay home, and they're wondering should they let the cleaning people in or not, or if they do, where do they go? If you're in North Dakota, South Dakota, Iowa, Arizona, San Diego, people are not doing the right thing, and partly it's I think they are more attuned to the Trump leadership and messaging than other places, and it's partly rugged individualism in the West and that sort of thing, more libertarian thinking. And the governors have said, we trust our people to do the right thing and be prudent, and then they don't.
But, well, I think this has really been the case in the Dakotas.
Yeah.
Where one of the governors has talked about her deep faith in the people to make their own decisions. And, of course, the rate has been spiking, which seems to be evidence au contraire, right? I'd love to hear you speak about what's happening in Southern California right now, which is really astonishing. I mean, the outbreak in Los Angeles County, and they don't seem to be able – I mean, they're at a 0%, ICU availability suddenly.
I remember even in that state, the governor showed up at the French Laundry, a very fancy restaurant.
Yeah.
The wine country, no mask, crowd. And that isn't Donald Trump. That's blue lefty Gavin Newsom. So the leadership there hasn't been kind of what it is. And then this is a deeper issue, but before COVID, the hospital systems in the U.S. were trying to get on a business model. I've never liked it because it means just-in-time supplies. They have no reserve. In California hospitals, they're understaffed. It's not like they filled up the ICUs. And why didn't that happen in New York last March, April? It's because we have more ICU beds and we weren't as tight as they were. So for the size of their population, they don't have the right healthcare system. And that's an interesting issue, which we'll have to go back to post-COVID. So it's great that they're efficient pre-COVID. It's disastrous that they don't have a reserve or a backup. Also, one other ethics issue, they're trying to hire nurses, I believe, from other countries or traveling nurses, and basically they're going to the places that have the money. So the places that are hardest hit don't have the nurses because the places that are rich are buying the nurses that are traveling nurses or coming from the Philippines and this sort of thing. So a lot of inequity in evidence in California. The other thing I'll say is something's going on there. It's not libertarian so much, but I think people thought we're outdoors. It's a nicer climate. It'll protect us. And I think they didn't sit far enough apart and do all that sort of stuff.
Right. So they were taking, it was sort of the sunshine ethic, thinking,
exactly.
that'll take care. I mean, John and I are both from Southern California. We know all about it. I mean,
okay.
We may have been the most pasty-faced boys at the beach, but there's a lot of that.
Yeah. Pasty-faced and pasty-bodied, I think, as well. Hey, we were talking. We got to wrap this up pretty quickly here for you, Art, because I know you have to be in another place. Yeah. But let me talk about very briefly. We were talking earlier about what Biden has to do to get this thing across. Now, let's layer in what you just said about the fact that the far West is the Wild West, and they just don't care. How do we reconcile those two things?
Well, I think the big reconciliation will come through vaccines. There may be resistance. People may say, you can't force me, you can't make me. But two things are going to happen with vaccines. One is, I assume, we're going to see death rates go down, and we're going to see your grandma not die. And that has to make an impression on people about what they ought to be doing. So I think even though they don't like masks, they're probably going to see that vaccines really work in a concrete way. And the other thing I'll say is, if you get vaccinated and these things work, you're going to get more freedom. You're going to get to go back on an airplane or go back to the gym or get on a cruise ship. You get a reward, if you will. Whereas wearing a mask, I don't know that you saw the reward so quickly. It was like, abstract prevention. So I think we're going to see a shift in the culture, and I think it'll be vaccine driven. That comes at the cost of 300,000 plus dead people, but that's a shift.
I wonder, this came up in our talk with Paul Offit recently, where he said he's wondering whether we're going to all start wearing masks during flu season in years to come, especially if, as he expects, I don't know if this will come to pass or not, that the flu numbers plummet this year. Because
it did, as in Australia and other places too, the masking helps when you do it. My prediction, no, but more of it in the elderly. I bet if you go to a Broadway show a year from now, that group will be masked. I bet if you show up at some hospital systems, you're going to be masked as a visitor to get in. But 25-year-olds going to parties, I don't think so.
Yeah, I'm afraid that strip club is going to be no masks.
I think so. I think so. How soon, final question, how soon do you think we will get back to normal, whatever normal is going to be?
I'm going to say a year from now. Should have pretty much covered the crowd that needs to get vaccinated. I think we'll have beaten down the virus a little bit by stopping contagiousness. A year. I would give it one more year. But I think we'll be able to be safer in 4 to 5 months. I think it's going to get better.
Okay.
That's a piece of good news to end with.
There you go. My optimism is coming back slowly.
If I have to sit here another year looking out the same window at the same desk, I'm going to be an institution.
Art Caplan, thanks very much for being with us today. It was great, and maybe we'll come back in another 6 or 8 months and see how we're doing then, and whether or not your predictions are
very good. Let's have the 4-month appointment. We'll see if I'm right.
Happy New Year, Art.
Thank you. Same to you guys.
Bye-bye. And thank you for listening to the Musical Innertube in 2020. What a year. Hopefully 2021 will be better, and the Musical Innertube will be there for you. If you'd like to get in touch with us, the email address is musicalinnertube, all one word, @gmail.com. On Twitter, John is @JTimpain, Don is @DonRooney9. Our webpage is Musical Innertube, that's musical spelled with 2 A's, .libsyn, spelled LIBSYN.com. The Innertube is available on Amazon Music. If you're a member or subscribe to Amazon Prime, just type Musical Innertube in the search box. We're also available on Facebook, YouTube, Apple Podcasts, Stitcher, Spotify, SoundCloud, iHeartRadio podcasts. Like us and give us a good review on any of those platforms. And start the new year right. Head on over to musicalinnertubeplayers.libsyn.com. That's musicalinnertubeplayers, all one word, .libsyn, LIBSYN.com. And you can relive Christmas with performances by the Players of Father Hardy and the Holy Nail, A Christmas Carol, and Santa Gets Scrooged. And as always, thanks to virtual band Car Radio Dog for our theme music.